Thank you, Kelly, and good morning. And thank you for joining me. As you heard, Dr. Rabarou was scheduled to give today's talk, but unfortunately he was not able to be here. But I am excited to talk about the Brain Health and Wellness Project, which is a collaborative initiative between the Canadian Coalition for Seniors' Mental Health and the Fountain of Health, which I'll talk about later. And it's quite supported by the Canadian Academy of Geriatric Psychiatry. Dr. Rabarou has been a pioneer in the project and is also one of the site co-leaders, along with myself and Dr. Chandrasena. I really came to this work through my interest in cognitive behavior therapy with the elderly. So at the end of the talk, you should be able to discuss a new model of healthcare delivery, which the focus is on promotion of successful aging, recognize the importance of optimizing brain health, its impact on risk reduction and prevention of illness, identify 5 evidence-based health domains for optimal aging, and apply the Fountain of Health cognitive behavior therapy tools, which are available for healthcare providers and also the public. But the ultimate objective is to encourage and invite you as a clinician, regardless of where you're practicing, to become a part of this project and to engage your own patients and even yourself and your colleagues. So just there's no conflict of interest. And in the words of Ben Franklin, an ounce of prevention really is worth a pound of cure. And these words, I think, ring louder than ever when we realize that most of our healthcare expenses are incurred not only once diseases are diagnosed, but often once they're significantly progressed. So we're looking at an actual inversion of the traditional age pyramid. In Ontario, currently 16% of the population is over 65, and in 20 years that percentage will double to over 30% of the total population. So the same trends are occurring across the country, with the over 85-year age group as the fastest growing age group in Canada. And this shift is also a global phenomenon and will have a global age column rather than an age pyramid. And with this growing senior population, it's an increasingly significant part of our society's future. We need to make a significant investment. And the Fountain of Health was really developed in response to these demographic shifts to help Canadians optimize their mental and physical health across the lifespan. This is information from the Canadian Institute of Health Information, which demonstrates increasing healthcare spending. It's a year old, but I don't think there's anything different that's been projected for the next year. Again, just signifying the significant expected increase. And there's a huge discrepancy between what we understand makes us healthy and what we spend our health dollars on. So 50% of what makes us healthy is based on health behaviors or lifestyle, but only 4% of our health dollars is spent on healthy behaviors. This is a map just illustrating the predicted increase in Alzheimer's disease by 2050, a rather dramatic forecast with very significant increases globally and in particular in developing countries. The Alzheimer's Society of Canada published the Rising Tide document actually in 2010, which is rather surprising how old it is now, but it was one of the first studies to estimate the health and economic burden of dementia in Canada over the next 30 years. And you can see the numbers of people that will have dementia, the dollars of care this is going to equate to, and the number of caregiver hours. And 4 interventions, including increasing physical activity, delaying the onset of dementia, increasing caregiver support and training, and navigation, system navigation were analyzed, and were all shown to have a potential for dramatic reduction in economic impact over the next 30 years. The mental health Commission of Canada came out in 2011, and again, its report also has a fair amount of attention paid to prevention, health promotion, and early detection. The World Health Organization guidelines came out a few weeks earlier, and a report on risk reduction of cognitive decline and dementia. And they state that dementia is a rapidly growing public health problem affecting around 50 million people around the world, with nearly 10 million new cases each year, and inflicting a heavy economic burden with costs of caring for people with dementia estimated to rise to US $2 trillion annually by 2030. So while there's no curative treatment for dementia, the proactive management of modifiable risk factors may delay or slow the onset. And they specifically list in their executive summary physical activity interventions, cognitive interventions, and social activity. So there seems to be a general recognition of the importance of prevention to improve health, care, and create sustainability. But I'll ask you just to take a moment to pause and reflect upon your own practice and where you're working, and how much of your time is actually spent in prevention. I know if you're like me, probably do some, but it certainly isn't the majority or even a very significant amount of how we spend our time. So why are we not there? While evidence clearly shows lifestyle interventions and behavior change to be one of the most effective first-line forms of therapy for reducing chronic disease, the majority of physicians or other clinicians are not following these guidelines, citing lack of knowledge, skill, or confidence in counseling patients about lifestyle interventions. And here are some of the barriers that I've heard from other individuals. I don't have the time, I don't have the training, this is not my area, my patients are too sick for this. I counsel people all the time, but they don't follow through. I just can't get my patients to do things for their health. And I've certainly had some of those thoughts myself. So, what is the Fountain of Health? And in 2011, it was founded by Dr. Carrie Lee Cassidy. She's a geriatric psychiatrist at Dalhousie, along with a team of clinicians and academics, and over the last several years has become a national initiative collaborating with several organizations and individuals to translate the science of healthy aging, neuroplasticity, and resilience to the public and healthcare providers. It uses effective, practical CBT tools to address aging attitudes and their health behaviors. And the goal is to contribute to a movement for optimal aging that's evidence-based, led and supported by healthcare providers, but that extends into the community in order to promote healthy aging. And this is just a snapshot of a number of the national partners, and as you can see, there's many individuals and organizations that have contributed. It was developed by national experts and clinicians. It empowers patients to use a preventive health model to improve cognitive, mental, physical health. And it provides clinicians with frontline health behavior change tools. The project is promoting a paradigm shift from a disease or pathological model to including wellness as a goal. Provides an opportunity to transform healthcare and optimize brain health, aging, and resilience. Can be integrated as first-line interventions across the spectrum of health and illness, and it holds enormous potential to curb healthcare costs. So did you know only 25% of longevity is accounted by inherited genes? I actually found this quite striking, and this was based on Danish twin studies. So it means that our lifestyle, outlook, and environment can have a much greater impact. and provides us with an opportunity. So what are some of these lifestyle factors? Well, certainly physical activity. It's a vital protective factor for long-term resilience, yet 60% or over of Canadian adults are considered sedentary, meaning they don't meet the guidelines for at least moderate physical activity, which is 150 minutes a week. And that was also what was in the World Health Organization guidelines. Social isolation and loneliness, they have the same health risks, same magnitude as smoking, hypertension, and obesity. And I'm sure many of you heard a few years ago in Britain, they have the Ministry of Loneliness, just highlighting the importance of this factor in our current society. Brain challenge. Lifelong learning is a key protective factor to support long-term brain health and prevent cognitive decline. The Lancet report that came out 2 years ago estimated between 30 to 35% of dementias might be secondary to modifiable risk factors. Positive thinking, and this is an area that I find really quite fascinating. Negative self-perceptions, especially with aging, that's actually an independent risk factor that significantly impacts health behavior and long-term health outcomes. And of course, our mental health and looking after and treating depression and chronic anxiety can optimize resilience and long-term well-being. So in psychiatry, we're very familiar with the basic cognitive behavior therapy model, which examines the role our thoughts have on our behavior and in our emotions. And unfortunately, negative views on aging are all too common and may serve a self-fulfilling prophecy. So for example, if I believe I'm over the hill now and it's all downhill from here, why should I bother doing anything? Likely lead to sedentary behavior. Whereas if I thought I have a significant role in society and in my future, maybe I'll want to make a difference and I might lead to different behaviors and physical activity. So here's an interesting study that was done by Becca Levy at Yale, and she demonstrated that a more constructive self-perception of aging is associated with additional years of life. So she followed over 600 individuals, 50 years of age and over, for 23 years. And she found that if you controlled for other health factors, you would live 1 to 3 years longer if you had low blood pressure, cholesterol, BMI. And if you had no history of smoking and a tendency to exercise, you gained 1 to 4 years. Meanwhile, if you had a positive perception of aging, you actually gained 7.5 years. So again, rather dramatic. So I'm just going to show you a little clip of the Fountain of Health.
Perhaps the greatest success story of modern medicine is the nearly doubling of our life expectancy, from 50 to 83 in the past 100 years. This medical triumph means we have nearly twice as much time to enjoy. So how do you plan to celebrate that? Should you moan about milestone birthdays or joke about expecting to lose your memory? Forget that. It's time for a new approach, a change that starts from within. Changing your perspective on aging will set you up to value and enjoy those extra years. Changing the way you think about aging might actually be one of the most important ways to stay healthy. Turns out, attitude is key to longevity. Your family genes account for only 25% of your life expectancy. Lifestyle and attitude play a much bigger role. You really can do things to take care of your brain health, and that includes changing your outlook. While there's no such thing as a fountain of youth, who needs it when the real dream is to live a long, healthy, and happy life? Our goal is to equip you with the tools to do just that. The Fountain of Health is your source for science-based steps to promote health and vitality and reduce your risk of illness or disability as you age. It's a national initiative for positive aging, backed by health professionals, researchers, and Canadians just like you. We know the Fountain of Health will inspire you to become part of a culture shift aimed at helping all Canadians age well. So are you ready to tap into your Fountain of Health? Just follow these 3 simple steps. Learn about the 5 key areas for healthy aging. They are positive thinking, staying socially active, physical exercise, lifelong learning, and taking care of your mental health. Practicing these strategies will reduce the risk of depression and dementia while maximizing your health and happiness. Answer 5 key questions to find out where you currently stand. How successfully do you feel you are aging? How socially connected to others do you feel? How physically active are you? How interested are you in learning new things? How likely would you be to seek mental health help if you needed it? Now that you know where you stand, you can set a goal in each of these 5 areas to improve your health. Keep in mind, the more realistic and specific your goal, the more likely you are to succeed. To tap into your fountain of health, complete those 3 steps with the help of our handbook. By changing how you think about aging, you can protect and invest in the most precious resource for your future, your emotional and mental well-being. Your personal fountain of health. Now that's something far too important to ever forget. The Fountain of Health. Healthy living, positive aging.
They've distilled that there's actually 5 key modifiable health and resilience factors. So keeping physically active, staying socially connected, engaging in lifelong learning, changing how we think about aging, and taking care of our mental health. And there have been a number of experts in each of these areas that have contributed to the data, and all of the evidence is available on the website. So what is the Brain Health and Wellness Project? So as I mentioned, it's a collaborative initiative between the Canadian Coalition for Seniors' Mental Health and the Fountain of Health. It's funded by the Researcher Clinician Partnership Program from the Center for Aging and Brain Health Innovation, and it's led by Baycrest and helps innovators develop, disseminate, scale, and promote adoption of promising innovations in the aging and brain health sector. So the project is actually a quality assurance project where we're evaluating feasibility, acceptability, and effectiveness of this approach and the tools across Canada. So there's no requirement to seek written patient consent. But the ultimate goal is to promote patients' brain health and well-being one small step at a time. And so I'm really hoping at the end that some of you will participate and register. So if you're thinking, what's in it for me? So there's access to an evidence-based, easy-to-use health behavior change toolkit that's already designed for frontline care. Hopefully it'll increase your comfort and confidence in activating health behavior goals easily and efficiently. Increase skill in achieving those health and self-care goals for yourself and for your clients. So what you need to know is we're looking to engage individuals who are over 40, age 40 and over, and this could include the client that's in front of you, but also their family members or caregivers. Really, the only exclusion is for people with dementia, and it's not that these concepts wouldn't be useful or couldn't be applied, but really the language may not be appropriate because it's designed really as a preventive tool. So the process takes a few minutes in the context of routine care. All the data is anonymous and confidential. All we're requiring is the initials, so there's no names and there's no written consent. So the project's purpose is really to support you, the clinician, to invite patients to activate key behaviors known to promote brain health and wellness. And it's really designed for clinicians across a number of different settings and for Canada, and has actually worked in a variety of settings. I work in a very busy geriatric psychiatry outpatient outreach clinic, and I had a number of those thoughts that clinicians often do. I don't have time, my patients are too sick, but in fact I've actually found it very useful and been very surprised at how my patients have picked up and really seem to have engaged. So the project focuses on 3 key areas: the physical activity, social connection, and brain challenge. But other areas can also be included, such as nutrition, taking care of mental health, use of yoga, meditation, or really any other area of the patient's choosing. In my experience, though, they often choose the first 2. So whether you're working with someone who has pre-existing heart disease, hypertension, diabetes, arthritis, depression, obesity, addictions, insomnia, and the list goes on, what non-pharmacological treatment improves outcomes? What's the #1 powerful promoter of brain neuroplasticity? And perhaps the single best thing we could do for our overall health? That's just to move our bodies. So all forms of physical activity help, mild to vigorous, strength training or cardiovascular. It's really the avoidance of sedentary behaviors. So some people are saying sitting is the new smoking. And in many of the guidelines, it's about 150 minutes a week that is recommended. But even going up a daily flight of stairs increased gray matter to about half a year younger age. But even light physical activity, just 15 minutes, was a comparable benefit to giving up smoking. And exercise is also a benefit, of course, in mild to moderate depression, and it's in the CAN-MAT national guidelines. So secure relationships, social connectedness, it's a basic human need which heavily influences our brain health, our resilience, and is associated with lower risk of dementia. So finding ways to continue to build and rebuild social connections and attachment relationships over a lifetime is actually critical to healthy aging and can be difficult for us the way our society is structured. And here's a really interesting study called the Harvard Study of Adult Development by Robert Waldinger. And it's the longest study on resilience, 75 years. They looked at over 700 people, and they had a group of Harvard sophomores, and they compared them to the poorest individuals of inner city Boston and followed them for 75 years with interviews, initially with them and eventually with their families, and eventually did CAT scans as all of these things became modern day technology was included. Actually, 60 of those original are still alive, and now they're actually studying their children. And in that group of Harvard sophomores was actually one of the American presidents. So based on that data, it was actually the secure relationship at age 50 that predicted how well you were doing over the next 25 years. So pretty fascinating. It also improves social connections, improves cognitive health, lowers dementia risk. Social isolation has been linked to higher rates of infection, depression. So this is very important that we encourage and try to facilitate this. Brain challenge contributes to cognitive reserve, which we think might be important even in the context where dementia pathology is present, but may delay symptoms. So activities can include learning a new language or instrument, reading and creative writing. Really any new activity can count, but just giving up routine. So novelty is key. So what are the Fountain of Health tools? So there are paper-based tools that you can use in the office, and they can also be electronic versions. And there's also a wellness app that was developed and can be used to provide the individual with support and encouragement in between the visits of your office. There's just a special thanks to Dr. Beverly Cassidy. She's another geriatric psychiatrist at Dalhousie, and she was instrumental in developing the tools, and there's also the app development team, and Dr. Roger Hamilton, also a family physician who was involved. So, do these tools work? So it's actually been field tested in over 500 patients to date, and 80% success rate in goal attainment, with many of these patients actually exceeding their health goals, and an even greater success rate with using the app. 73% also improve their self-rated well-being measures, and from the clinician point, it was found to be easy and time efficient for 80%. So most people want to see change happen, especially positive change like this. However, it's harder to actually change our own behavior and habits. We all need support and encouragement to take one step at a time. So, why should you consider trying it out despite the barriers? We think it works as a no-brainer for clinicians, because the reality is most of you already do invite behavior change every day. But most of us lack support for this important work. We do it without much, if any, training. We often lack a systematic approach to patients and lack measures to assess how it's working. So this initiative is meant to address all of these issues. So what supports are actually offered? Once you register, you will get all of the materials. There's a change toolkit, and if you want, you can get the actual binder, which will have everything in it, including a lovely poster and little postcards that you can put in your waiting room. And I've actually found the poster is just hanging it in my wall in my office. People ask me about it, and that's a lovely segue into telling them about the project and inviting them to take part. There's also site leads, there's educational coaches, so if you're thinking, oh, maybe this is something my team might like to hear more about, you can request to have an educational coach come and do a quick seminar about how to use the tools. And there is a project manager, and then there's site project coordinators. And the examples of participating clinicians, there's a wide range, and there can be other individuals who wish to be a part of it as well. And here's a link just to the clinician education video, which you can watch at any time. And it's really just a reminder for me to tell you that it's there. And it also shows a role play, so actually to see it in action. So here's how it works. There's actually 3 steps. So first, you're going to invite 5 or more patients to self-complete a baseline on a health and resilience pre-questionnaire. The second is to help the patient set one small SMART health goal in one of the 3 domains: physical activity, social connection, or brain challenge. You're going to document that on a goal documentation sheet, and then on the next visit you're going to check in and track the progress, and about a month later, but this could be 4 to 6 to 8 weeks, you'll redo the health and resilience questionnaire and then look at how they were on their goal attainment. So it's pretty simple, takes a few minutes. So what are SMART goals? And this is really the key component for the clinician, is to help the individual set that SMART goal. So it stands for specific, measurable, action-oriented, realistic, and time-limited. So you want to ensure that the goal is meaningful to your patient rather than purely medical, and include the fact that really no goal is ever too small, and that over time, big health changes can happen. And if we reflect on our own lives, any kind of health change behavior, we can recognize how significant that is. And also to let people know that falling off health behavior change is entirely normal. And if that goal didn't work, you can invite them to set a different goal in an entirely different area, or scaling it down. So the idea is there's really no shame, no blame. So let's try and make a SMART goal even smarter. So if someone said they wanted to increase their physical activity and they said they'll walk their dog for 10 minutes a day, we want to make that even more specific. So I'll walk my dog for 10 minutes in the morning, at least 3 times a week for the next 4 weeks. So increasing that specificity is going to help to make it successful. And easier to track, to know that they've done it. So here are some examples of small SMART goals. Walking to the mailbox 3 times a week. Getting up during ads during the 6 o'clock news 4 times a week. I had an individual who just wanted to lift, a can of soup during commercials, or social activities. Setting up a coffee date once in the next 4 weeks. It can be as small as whatever small change they're willing to engage in. And recognizing the importance of the trusted relationship you have with that individual can really be beneficial. So questions to ask to help set a goal. How realistic is this goal for you in the next few weeks? When's the last time you did this? Because many people have been saving that goal for the last 5 to 10 years, such as joining the gym. So you really want to scale that back and set what's realistic for that individual. How confident are you that you'll accomplish this goal? What time of day or week is most feasible? Trying to look at those specific barriers with you and having that review will be beneficial. How likely is it that you'll actually do this? Another good question is, if you were successful, how meaningful for you would that accomplishment be? And it's really a ripple effect. So the idea is that these small changes, you get success, increases your self-esteem, and then you can continue. So, and it's what we call in CBT that there is cognitive dissonance. So if I start out saying I don't have time, but then to do any exercise, but then I'm actually able to set aside 5 minutes and do some exercise, experience success, it then opens my mind to the possibility, what else would I might be able to do if I put some importance on it. And then of course make sure the goal is safe for the individual to pursue. So the focus is really changing from a disease model into a wellness model, rather than framing a behavior change for medical reasons. So enjoy being independent rather than to improve your score on the frailty index. Enjoy getting out with family or friends rather than to avoid social isolation as a depression risk factor. Enjoy learning new things, etc. So help to shift that disease-based paradigm in healthcare towards the inclusion of brain health promotion. So the toolkit, so there's an office laminate, which actually helps you to, goes through all of the steps, and on the back has the different areas, so some speaking points. There's actually a clinician flow sheet in the binder that goes through each step. There's the questionnaires, and there's a goal documentation sheet, and there's also a take-home sheet for the patient. So here's the office laminate. And it helps, I found, to actually have the binder right beside my desk, so it reminds me also to talk about this. So here's step 1. You're going to do the pre-questionnaire, and there's just 5 questions out of 10, a Likert scale. And on the app, there's little sliders that they can move across. And the tools are all available in French as well, if anyone wishes. The website, unfortunately, is only in English, but the tools are available. And you get a score out of 50, and then that's really can be the starting point for setting the goal. And it's important here that this is an invitation. It's not a prescription. As we know, prescriptions tend not to work for long-term behavior change. It's really inviting them to take part. And we have a few sort of segues or little talking points that you might use. So if they scored low in one area, that might be the area you want to focus on. So based on your answers to the health and resilience questionnaire, it looks like you feel there's room to improve your wherever their lowest score was. So we call that the classic invitation. There's also the ideal invitation. If you're seeing someone to monitor their blood pressure, their depression, given your issues with blood pressure, this makes you an ideal candidate to participate in this project. Would you like to set a goal in one of these areas? Or it could be the seat that we call the 4 seasons. So it seems that finally the weather is improving. Perhaps you'd like to set a goal in one of these areas, or a life transition. Now that you're just moved into a retirement home, perhaps this is a good time to set a goal. Then you're going to complete the goal documentation sheet, putting down that health and resilience pre-score, recording what they've actually set as their SMART goal. And then you're going to give them the goal sheet that they take home, which also lists other activities that they might want to consider for next time. And it's helpful if they write it and write it in their own words what that goal, again, it increases the meaningfulness of it. And really at the end, it's just tracking the progress, follow up at 4 weeks. This can be done in person or by phone. So I've had some family doctors who've used other individuals in the office to help them complete it. And you're going to go through that documentation sheet and rate the patient's goal attainment. So did they partially meet their goal, fully meet it, or exceed it? And you really want to emphasize any change in the positive direction. And again, no shame or blame if they haven't been able to, but it could be an opportunity to explore the barriers and invite them to perhaps set another goal if they're interested. So the wellness app, what's nice about the app is that there's little inspirational and encouragement messages throughout those 4 weeks, and they track their progress. And there's links for a number of online resources, so about insomnia, anxiety, stress management, nutrition. So and there's 3 ways that you could use the app. You could invite the patient to register for the app, and they could do the first questionnaire in the waiting room before the visit, or you could help them set the SMART goal during the visit and then record it on the app. So you're going to be instrumental always in setting that SMART goal. Or it could be assisted during the visit. They complete the paper questionnaire in the waiting room, and then you help them register and set the goal on the app during the visit. Or they do the whole paper-based process and invite them to register so they could do this later on their own time. So in my work with my particular patients, they have not been using the app, but I think it might be very interesting for some individuals. This is just to give you an idea of what the app actually looks like. And there's a daily check-in and goal tracking calendar. So here it says, good to see you, Paul. And how are you doing with your goal that you set, which was to phone your sister 2 times a week in the evening. And it uses sort of a traffic light measurement. So are you ready to do this today? Which is green. Are you ambivalent, not sure, yellow, or red, not ready, or I've already did it. And then you track it on the calendar. So the next steps are really to go to the website and click on the Wellness Project, and you'll get your toolkit and your binder in the mail if you choose. So target your patient population. If you can find 5 or more patients to set these SMART goals. The project we're winding down by the end of July, so that's why there's this real force initiative to get as many clinicians and individuals enrolled. Then you're going to do these questionnaires before and post. And then you'll email, fax, or send everything back to the coordinator. And that's really the bulk of the project. And I've just included some of the website resources for health education and goal setting that are available on the Fountain of Health website that are very interesting, and both for you and for your patients. So thank you very much, and here is the website, and if you have any questions, you can email the coordinator, and I'm happy to take questions here.